Did you know that exercise is considered the most effective non-surgical treatment when it comes to managing your hip and knee osteoarthritis? Unfortunately, only about 30% of people with OA meet the physical activity guidelines of 150 minutes of moderate to vigorous physical activity each week. So, what are some of the exercises you can do, and why are they good for you? Well, aerobic exercises, like walking, can actually help to combat a lot of the comorbidities seen with people who have OA, such as diabetes, high blood pressure, etc. Strength and flexibility exercises can help to improve your muscle strength, improve the stability in your joint, increase range of motion, all of which will help you to ultimately reduce your pain. Now, experiencing some pain during exercise with OA is completely normal. On a scale of 1 to 10, if your pain rating goes up about 2 to 3 points during exercise, that is considered completely normal. You just have to get through it because ultimately the benefits of exercise outweigh the risks.